Thanks for joining us at 5. I'm Rolly Hoyt. This summer has been our first real attempt at, quote, living with the virus. Well, living with the virus means we've got to be ready when cases start to surge. That's what we're facing right now, and as THV 11's Ian Russell shows, he's got a warning from the experts why still caring is still very important, especially if we want to get back to a better normal.
Yeah, we've seen these same spikes and valleys over and over again, and much like you, we're wondering, when does this end? If you're sitting there thinking to yourself, this feels repetitive, we get it. It feels the same for us too, but there are still rising COVID cases. I mean, we can look at this data and show it. That data may feel repetitive, but it does help give some insight to what's next. The Department of Health is preparing for yet another surge, meaning we're not out of the woods or even close just yet.
Then over time, we'll learn about how often people need to be reboosted.
Dr. Jennifer Delahaye with the Arkansas Department of Health isn't mincing words. COVID will most likely surge again, and a third booster will probably be available to people at high risk by the fall.
And I think that's going to be helpful to us because of the highly transmissible nature of these subvariants.
The newest of those is BA.5, which Dr. Delahaye says is the most dominant in the country right now. Speaking of being the most dominant, Arkansas is currently leading the nation in COVID cases. Not a stat that's good to see, but with seemingly never-ending waves of COVID, many are wondering, when does this end? Unfortunately, it might not.
You know, this virus is here to stay. We're not going to wipe it out, and it's not going to go away.
Add in that many of us are feeling burnt out when it comes to the pandemic, and it's hard to overcome this. And changing public perception isn't easy.
And so I think going around with the view of, oh, everybody's going to get it is just ceding defeat.
Dr. Robert Hopkins at UAMS says he gets that burnt out feeling that many have, but at the same time, he says apathy isn't how the pandemic ends, and neither is herd immunity anymore. Staying on top of vaccinations and boosters will eventually end this, especially with the new work being done to make them better.
There's continuing work going on around additional vaccines, around different types of vaccines. So don't throw in the towel while we're still working on the tools.
In Little Rock, Ian Russell, THV 11 News.
Ian, thank you. And Dr. Hopkins says the data is even more obscure because the cases that we're showing are because testing has come way down. Many cases are never even getting reported to the health department. Hopkins estimates that we may have nearly 5 to 10 times more infections than the case numbers reflect.